this is the vacuum.
Oh wow.
Okay, so it's called a kiwi cup.
Yeah.
And rather than being a great big plunger attached to a machine,
Yeah.
that goes on the baby's head. Okay, and they literally pump it like that to put the suction, and then as mum pushes, we pull, and it puts some traction. But it is literally suction to the baby's head, and they are born usually with a big blood blister on the top of their head, and it can also cause the skin, to a little tear in the skin, and they have a little chignon on the top of their head. Rest them. So it's not ideal. You don't want it to cause that, And the forceps are like salad servers, like two metal sort of handled long salad servers, and we put one round the head, run them the way like that, link them together, and then literally as the mum pushes, they use the forceps to help the head out. But the forceps are used when the baby's head needs to be slightly moved into a different angle, so you can manipulate it. But if you've ever seen babies born with forceps, they sometimes have like a little loop on their face, a bruise, and it can cause the jaw to have pressure, can cause problems with feeding then, because the baby's got sort of a headache and had pressure. But obviously we're avoiding complications, and this is why in other countries you end up with a lot of ladies dying in childbirth with the baby sort of actually being delivered, and because we have what we have here, we're able to take them to theatre, do a forceps delivery. If you get a failed forceps delivery in theatre, it will go straight to caesarean very quickly. But I think the problem is with this is, and that's why I'm looking at my lovely pregnant ladies, it makes childbirth seem really risky when you hear that. And of course, if you hear someone else's horror story, you're going to think, oh, I need to be in hospital. Whereas I'm totally pro home birth. And when you have a home birth, the midwives are with you, skilled midwives, usually almost more confident midwives, because they're capable of dealing with emergency if anything happened without, they're not used to being supported by the team. And if anything is going off plan, we just go into the hospital. And other than on television, there's never that emergency. We'll just say, your blood pressure's creeping up, we'll give it another hour. Right, I'm not really happy with that blood pressure, we'd like to take you in. Or I'm listening to the heartbeat, we'll give it another hour. We're able to pick it up when it's deviating right at the beginning, and as soon as it deviates from going exactly how we want it to, we'll transfer you to hospital. And many a home birth started at home and then they had a normal delivery at the hospital, but it just means that you're there. So unless you have risks in your pregnancy and we can foresee something, you can have twins at home, but usually it's recommended, to be at the hospital. But we pick up any deviation early, but there's variation, huge variation, which is why midwives have so much training, because there's normal here and still normal here, but a big variation in between.